Thank you for joining Bonitas Sounds Call. Good morning.
Hi, good morning.
Yes, Priscilla, raise your voice a little bit, my dear, so the whole of South Africa can hear you.
Thank you very much.
Sure.
Yes, I've been having this headache for almost 4.5 years. When it starts, I'll be nauseous, dizziness, and I'm sensitive to light and sound. I've been going to doctors. They couldn't diagnose. I've run so many tests. So when I started, in fact, I started with different tablets. I've been drinking tablets, so many tablets now. So I don't even know when does it start. Because the way it started, it was maybe like twice a month or thrice a month. But now, anytime it can start. Even like now, I'm fine. But maybe around 1, then I'll be having that headache.
Well, so did you see a general practitioner or did you go see a specialist, Priscilla?
No, I only went to general practitioners.
Okay, and they did not refer you?
No, they didn't.
Okay. It sounds like migraine, do you agree?
It sounds like it.
Yeah. So what treatment are you on exactly? Just general painkillers?
No, I'm taking Alcodol. I think the attention headache tablets.
Yes.
Then the migraine, then the Allergex and nausea tablets.
You're taking migraine as well?
Yes.
Now, in your view, what have you identified to be a triggering factor? What brings on this migraine in your case? Have you ever picked up, maybe? In some people, it's menstruation, stress, certain drinks,
menstruation. Almost keeps it menstruation. Towards menstruation.
Okay. A poorly managed migraine. Thank you very much for sharing your experience with us. We have a migraine specialist here, Dr. Shevel. I'm sure he'll be able to give you some advice. And I'm going to tell you, he mustn't say you must come to his clinic, but let's hear what he's got to say.
Well, the first thing is...
She's got migraine, yes, most probably. Okay.
Most probably. But the first thing is the kind of medication. And this is where we get back to rebound headache. It's now been called medication overuse headache. All these medications, if you take them on a regular basis, there is a danger that you're going to make the headache worse.
Okay.
And so the headache gets more severe and more frequent. So you take more and more tablets, and it's a vicious circle.
Okay,
and
we are going to an ad break. You hold it there, and when you come back from the break, in relation to Priscilla's problem, you've got to tell us exactly the current and the modern approach to management, not treatment, but management of migraine. When you return, we'll continue our discussion on treatment of headaches. You stay with us. Welcome back. You're watching Bonitas House Call here on SABC2, and today we're discussing treatment of headaches. Can you just finish off management now of migraine?
Certainly. The management means that first of all, one has to find out where is the pain coming from.
Okay.
Something has to be hurting. Now we know that the brain is more sensitive to incoming messages, but the messages are coming somewhere. And our philosophy at the headache clinic is to find what structure the pain is coming from and to treat that structure. And what we have found, although pain can come from any part of the head and neck, what we have found is that most headaches, migraine or tension type headache, the pain comes from 2 structures, mainly. One is the muscles around the head and neck, the temporal muscle, the nuchal muscles, as Professor Modi said. And the other one is the blood vessels on the outside of the skull, not inside the brain. In fact, some people, you can even see them throbbing when they get a headache.
Okay.
So we determine where the pain is coming from, and then we treat that structure. And if you get, for instance, if it's muscle tension and you get the muscles to relax, then the headache will go away.
And how do you do that? How do you get the muscles to relax?
Well, this is where my dental side comes in, and this is why one has to have a multidisciplinary approach.
Yeah. Even to migraine?
Even to migraine, because in migraine, it's been well documented that there is tenderness of the muscles as well, the same as in tension headache. And most migraine sufferers, we use an intraoral appliance. That's one of the treatments. It's a plate that they wear in the palate, which makes the muscles relax. And when the muscles relax, the migraine very often goes away. That's it. In some patients, it doesn't. In some patients, the pain comes from the arteries, and we have to treat the arteries. But there are a number of ways of treating them, and I think that it's important to give the patient all the different methods. We use the normal medications that the neurologists use. for migraine and tension type headache. We use physiotherapy. We use intraoral appliances, which from my aspect is the most conservative way of treating. There's no side effects, etc.
Surgery?
We use surgery in a small percentage of patients.
Where do you operate exactly to treat migraine?
Well, for instance, if we have a patient who's not responding to the more conservative treatment, if I see the patient while they are having a headache, and the only way you can diagnose is to see the patient with a headache. If one closes off the artery just with a fingertip, that's a very, very, very sophisticated diagnostic tool. You close off the artery with a fingertip. If the pain improves while you've got your finger on and comes back when you take your finger off, then you know that if you close that artery permanently, the pain will go permanently.
Okay. And of course, if you close that artery, you know that blood can always move through the other collateral.
The scalp has got a tremendous blood supply. So you know when somebody has an injury.
So how do you do that? Do you take them to theatre?
Yeah, sure. We take some people, we do it under local, if there are 1 or 2. If there are more, we can do it under what's called conscious sedation or a GA, depending on what the patient wants.
Interesting.
But we give the patient the choice.
Now we know, so you can use medication to prevent or to treat the actual headache episode when it has started. You can also manage the triggering factors.
Yes.
If you have identified the triggering factors for a migraine, whether it is menstruation, it is stress or whatever, you can try to deal with that. If certain foods trigger the migraine attack, you can also deal with that. Now you say secondly, you can use physiotherapy to treat migraine, especially if you've identified where the pain is coming from, especially if it is coming from the muscles. But you said thirdly, you can also use surgery to try and deal with the artery that is causing the problem.
Yes.
I see you've got a point to make.
But I think we must understand that's not conventional treatment of migraine.
Okay,
this might be Dr. Shevel's treatment at his headache clinic. This is not the kind of practice that we promote or preach.
Okay.
I think it is very controversial. It's not just unconventional, it's controversial. And I don't think it's fair for the viewers to think that we can use these methods
I was coming to that point.
This is not standard medical practice.
Standard medical practice of treatment of migraine.
Standard medical practice of the treatment of migraine is to identify trigger factors, modify lifestyle, which is very important, and then what we use as the principles of treatment, if there are more than 4 headaches a month,
4 headaches a month.
4 migraine attacks a month, or even if it's 1 attack a month, but interfering with your lifestyle. So if you're a CEO of a company and you can't afford 1 day's headache or whatever, then we will prevent...
Even a domestic you can't afford 1 day of headache.
Yeah,
but
it's true. I have a nanny who gets a headache, I have trouble. Right? So what I'm saying to you is that depending on the circumstances, once the headache becomes debilitating and interferes with your lifestyle, then we will introduce prophylactic medication, which are evidence-based. Right. And then the acute treatments of the headache, important, like the lady was talking, she's using Adcodol. Adcodol is codeine, fantastic to relieve the headache, but creates rebound like you cannot believe. So that's a bad idea.
So when you stop using it, you get a headache.
You're going to get a headache.
That's what you call it.
But there are standard evidence-based treatments for breaking an acute headache.
So you say Priscilla must stop Adcodol.
I would stop her Adcodol. It's very nice over-the-counter stuff for the one-off headache.
What do you use instead?
Paracetamol, an anti-inflammatory.